Hi, everyone, and welcome to episode 2 of Tweezy Speaks. I just want to say to everyone, thank you so much for all the positive and critical feedback that I got following on from last week's video. I'm taking everything on board, and I'm just really grateful. Just knowing that people are watching the videos and are taking on board the information, having a conversation possibly about the information that I'm giving them. It means so much, and it means a lot to me. So thank you very much for that. For me, I want to be able to share my thoughts, my ideas, my points of view on matters that I deal with as a nurse, as a man, and as a person living in the United Kingdom, including what is important to me, because then I know that other people might be in the same position as me, might be going through a similar situation, and they maybe feel that the information that I'm talking about is relatable to them or somebody they know. That's why I'm doing this, so that I can get across to people. So, once again, thank you very much for listening, and I hope this helps. Just a reminder, if you're liking what you're seeing, you're enjoying the content, then please leave a like, share the content, and if you want to leave a comment and subscribe, that's fantastic. Hope you enjoy this episode. Take care. This is Tweety Speaks, and this is Health News This Week, bringing you snippets of information, health related from around the world. Hope you enjoy. Take care. The World Health Organization, WHO, faces financial restraints amid US funding cuts, and this is a news report provided by AP News. It discusses how the World Health Organization Director General Tedros Adhanom Ghebreyesus has had to readjust their budget from originally wanting to have a total of over 4 billion down to 2.1 billion. Now, it says about the US funding, as the United States of America was the largest benefactor to the World Health Organization. It's also a combination of other countries, mostly in Europe, who have now decided to reduce the amount that they allocated to the World Health Organization and have redirected that funding to defense purposes in the midst of what's happening around the world. Now, the World Health Organization does amazing things in loads of countries. For example, it looks to promote health initiatives such as reducing the sugar content in a lot of drinks and foods in third world countries and promote healthy homegrown products around the world, as well as helping other more deprived countries. Also, it deals as a global response to pandemics such as COVID 19 or outbreaks like polio or Ebola. Now, Tedros and his team have been grappling with the response from the US, saying that they are not going to engage with the World Health Organization or look to sponsor them to the amounts that they were doing previously. And this has caused a massive rethink, because now, where they were thinking of having approximately £4 billion, dollars, to incorporate in its plans for helping uh, countries around the world, it's now had to reduce that to 2.1 billion. Still a lot of money. However, the World Health Organization chief put that into perspective, that it's approximately a third of the uh, budgeting cost that tobacco companies use worldwide, and is a significantly low in terms of the defense budgets that America and European countries use. I'll keep you posted on that. Slovakia challenges global pandemic treaty at the World Health Organization Assembly, which is a news article by Reuters, and it discusses how the Slovakian Prime Minister said on Monday that his country would challenge the adoption of a potentially groundbreaking global treaty on improving pandemic preparedness by calling for a vote at the World Health Assembly. Now, what I would say on this matter is that I think it's imperative that there is a clear, concise set of policies, procedures, and infrastructure in place in case there is anything like a global pandemic occurring again, just so that there isn't any confusion and there isn't any delay in the lack of equipment. Being on the front line and seeing that happen was not a good thing to witness, experience, or have to talk to patients about. And I hope they're able to come to some conclusion over that. I think there will be some COVID-19 vaccine skeptics who may support the idea. However, overall, I think this will not get the backing, and there will be an approval for this pandemic treaty. So hopefully that will go ahead. Climate change linked to a rise in sleep apnea cases. And this is a report by Time, and it discusses how that climate change is worsening sleep apnea. It goes on to say how stuff such as exacerbating asthma, allergies, cardiovascular disease, the spread of waterborne pathogens all contribute to the way that we sleep and effectively sleep. Another factor is lifestyle, health, and most importantly, weight. So obstructive sleep apnea is how the muscles in the throat relax at night and obstruct breathing, reducing oxygen in the bloodstream. The effect can lead to a serious health issues and can prevent you from actually breathing effectively at night. With this, I would say that it's a combination of trying to live a more healthier lifestyle, being aware of your surroundings and your environment, having filtrations or filters in your property. If you live in the countryside, maybe it's the pollen, and then also trying to exercise, maybe going out for walks, dieting, and also being conscious of what you're eating. The World Health Organization is to award Botswana for eliminating mother-to-child HIV transmission. It goes on to discuss how it's also including hepatitis and sexually transmitted infections, and this was at the 78th World Health Assembly. During the preliminary session, which was held on Monday, the 19th of May, Director General will award Botswana for achieving gold tier status on the path to elimination of mother-to-child transmission of HIV as a public health problem. Botswana was already the first country in the world to meet the criteria for silver tier status on the path to elimination of HIV in 2021. Now Botswana is the first country to achieve gold tier status by reaching stringent targets for HIV prevalence among new mothers, HIV incidence among newborns, and service coverage for antenatal care, HIV testing, and antiretroviral therapy. Congratulations to Botswana. I hope this is, again, this shouldn't be good news. This should be something that is applied worldwide, and we should hopefully not see any of this occurring again. Thanks for listening to this edition of Health News This Week, and I'll catch you next week. Take care now. Bye-bye. So let's discuss the walnut in the room. 288,000 men in America, 52,000 men in the United Kingdom, 1.4 million men worldwide are affected annually by this. The risk increases as men get older, particularly after the age of 50. If you've got a family history, such as a father or a brother with it, it increases the risk of you being subjected to it as well. A man of ethnicity African descent, especially African American men, are at higher risk and they tend to develop this disease earlier and with more aggressive forms. So I suppose you probably guessed, but I'm talking about prostate cancer. And it's something that's been quite prevalent in the news because President Biden recently got diagnosed with stage 4. Now, I just want to discuss that a bit more and go into some bit more details with it. Before I do, I just want to say I'm sure he's receiving excellent care and treatment, and I wish him and his family all the best during this period in his life. So let's discuss what is stage 4 prostate cancer and what does it mean. So stage 4 prostate cancer is an advancement of the cancer, meaning that the cancer has spread or metastaticized to other parts of the body, such as the bones or the lymph nodes or other distant organs in the body. It's often referred to as metastatic prostate cancer. Symptoms associated with advanced prostate cancer like this is bone pain or fractures, difficulty urinating, swelling in the legs or pelvis, and fatigue and weight loss. Let's delve a bit more into the prostate and also prostate cancer. So, the prostate gland is a small walnut-shaped organ located just below the bladder in men. It surrounds the urethra, and basically that's the tube that we urinate from, which is linked to the bladder to the outside of the body. The prostate's primary function is to produce seminal fluid, which nourishes and transports sperm during ejaculation. As men age, the prostate may undergo changes, including benign prostatic hyperplasia, or known as BPH, which is a non-cancerous enlargement, and all men will get this. And one of the most common things is you're either going to have difficulty going to pee, or it's going to take you longer to pee, or you're going to be standing for a few seconds before something comes out. Or the other side of that is prostate cancer, which is one of the most common cancers in men. So, what are some of the prostate cancer statistics that we deal with? So, within the UK, prostate cancer is the most common cancer amongst men in the United Kingdom. And according to the Cancer Research UK, approximately 52,000 men are diagnosed with prostate cancer every year. Actually, in the UK, the National Health Trust or the NHS will send out regular appointments to men who meet certain thresholds. So, for example, if you're reached a certain age, or if you've had a family member, like I've discussed, and there's a history of cancer in the family. Also, people of ethnicity, so as well as Black, Asian, or other ethnicities, they'll be at higher risk and will be invited for a blood test to determine if their PS levels are raised or not. So going back ethnicity, so like I was saying, black men are at a significantly higher risk, with prostate cancer rates being more than twice as high in black men compared to white men. Around 1 in 4 black men may develop prostate cancer in their lifetime, compared to 1 in 8 men overall. Within the United States of America, incidence of prostate cancer, according to the American Cancer Society, advises that 288,000 men are diagnosed with prostate cancer annually. African American men are at an increased risk for higher incidence of prostate cancer compared to other racial and ethnic groups. African American men are about 1.6 times more likely to develop prostate cancer than white men. Within the Caucasian ethnicity, prostate cancer is also common in white men, with a diagnosis rate of about 1 in 9 men. So, what can you do? How can you check yourself? How do you know? So, Prostate cancer risk increases with age, family history, and ethnicity, particularly black men and men with a family history of prostate cancer. I personally say to all of my friends, I'm 40 now, but I know people who are older, go get yourself checked out. And also, it's always good to just get in contact with your doctor, even if you haven't for a while, and ask them just for a checkup routine at least once a year. If you've got any family members who have had a cancer scare, even if it hasn't developed to seriousness or they've been cleared, still makes you at a more increased risk. So it's important to discuss with family members just to get an awareness of the family health history, so to say. Regular checkups. So start discussing screening options with your doctor, especially if you're 50 or above or approaching 50 or earlier if you've got any family histories, like I've said, or you're within the higher risk group. Monitor your symptoms. So if you've noticed that you've not urinating like you normally would, or you've got a weak urine flow. By weak urine flow, that means how you would pee strong is not like that anymore. If you've noticed any blood in your urine, if it's painful for you to pass in urine, or if you've got lower back, hip, or pelvic pain, then it's important to contact your doctor to discuss that further. Self examination. So, there's no routine self examination for prostate cancer just because of where it is. Um, what you need to do is you need to attend regular screenings, you have your blood tests, and if you need to get the more thorough examination, then that will be explained to you. The regular blood test is called a prostate specific antigen test or a PSA test reading, and it measures the level of the PSA, which is a protein produced by the prostate in the blood. If it's elevated, it can indicate that that it is prostate cancer, but it's not definitive. If it just gives an indication that further investigation should be carried out. So there is no set amount. There's usually ranges, but a normal PS level is usually considered to be anywhere between 0 to 4, but levels can vary with age. High PSA level, so if it was say 15 and then they would call you back for another blood test and then it had increased further, then they'd say that they would want to do a biopsy just to rule out cancer. Now, the prostate biopsy is something that they actually take a sample of your prostate, which they send off to the labs to test. So this can be done via two ways. So it can be done via a transrectal ultrasound. This is the most common method where a small probe is inserted into the rectum to guide the needle, and then it takes a very small sample. Or a transperineal biopsy. This is an alternative method where the biopsy needle is inserted through the perineum, and this is the area between the scrotum and the anus. The most I can say is uncomfortable, and it's the expectation of something that you're not used to having done, rather than it being painful. It's over in seconds, and everybody are very supportive, always within your time of doing stuff, and always there to provide support and guidance to you. Other tests that might be carried out is an MRI, which is an magnetic resonance imaging screen, and they might use that in as well as the biopsy, just to get clearer images of the prostate surrounding tissues. Also to mention, as well as the prostate sample being taken, there may be a prostate examination, and this is where a qualified doctor will perform a digital rectal exam, often known as a DRE, and this is where they'll insert a gloved finger into the rectum, so to feel for irregularities or hard areas in the prostate. This is all done as, or can be done as well, alongside the PSA test. If you are diagnosed with prostate cancer, that is an unfortunate situation, one that is going to affect you physically and mentally. However, there is plenty of support, guidance, information, and treatment available to you, so that we can eradicate the cancer and get you back to living a normal life to how you were previously. Now, there's surgery, or there's radiation therapy. The surgery comes in the form of a prostatectomy, where we would remove the prostate, and you'd have all the information leading up to that time that would happen. The other treatment is radiation therapy, and this is where high energy rays are used to target the cancer cells. After that, you would continue to have annual and probably 3, 6, 12 monthly reviews at the hospital to see what your PSA levels are and to see if the cancer had come back. You would also be referred to the cancer specialist nurse, who would provide support, guidance, and see how you were mentally, yourself and your family, and to see how you were coping with the situation. You'd also have regular reviews with your GP and with the hospital consultants to make sure that the medications that you were taking weren't contraindicating with yourself or giving you adverse side effects. Another important thing to remember is that this is the second most common cancer in men. So you're not alone. There's a wide range of people and survivors who have gone through the same situation that somebody close to you or yourself is going through, and they're aware of all the complications and thoughts and processes that somebody might go through at this time. So you can reach out to people and get the information that you need. Hi guys, that's the end of the show. I just want to say thank you for watching. I appreciate it. I'm actually going to do a fact sheet, so I'll put the link up for that when that's finished, and that will give you some more information on prostate cancer, and just a few tips to look out for it and stay aware of it. And also, if you want to talk to people, there's also a few places that you can go to get some help. All right, thank you and take care. Bye bye.